Friends, good morning. How are you all? After a long time, we'll discuss one more small topic today. Today, we'll discuss about NPWT. That means negative pressure wound therapy. It is also called as VAC dressing. VAC dressing means vacuum assisted closure. Okay, so this was actually initially designed for abdomen cases. Okay, wherein the abdominal wall could not be approximated and closed in certain cases. So it was developed by certain surgeons for that initially, but later on it has so many benefits, and it was expanded to other wounds. So right now it is mainly indicated for non healing ulcers or wounds. Okay, what is the difference between an ulcer wound? That is a very interesting question that you will have to answer later on. Okay, wounds, especially lower limb wounds. Okay. You have been seen many cases in our wards also. We do a debridement for a cellulitis case or a necrotizing fasciitis case. After that, we keep doing the dressing daily. Okay, so but it takes time. Okay, so dressings are many types. The most common we do are the conventional dressings where we use this gauze, and we wash the wound with hydrogen peroxide and betadine, and then we put a saline gauze or anything, and then put a pad, and then roller bandage, and we see that if there is soakage we have to change it again. Like that we keep on doing the dressings, and then we use debridase ointment. uh, it is papain and urea combination. Okay, that lyses the collagen in the slough, and desloughing happens. Okay, that is called chemical debridement. Like that we can use maggots also. There is something called maggot dressing therapy. Okay, so these are all different kinds of dressings. What is the main aim of all this? The infection has to clear off, and the granulation has to start. That is the main goal of a wound care. Okay, now then only, if the wound is small, we can do a secondary closure. Okay. Huh? Or if the wound is large, once the granulation has formed, we can take a split skin graft from some other site and put over the graft. Okay, finally it has to come to the normal anatomical maximum possible state. Okay, so these are different kinds of dressings. So out of that, one of the advanced technique is NPWT, negative pressure wound therapy. So what we do is, in negative pressure wound therapy there are certain components. One is, at the wound site we apply something called as PU foam. Okay, this PU means polyurethane. Okay, this is హైడ్రోఫోబిక్, అంటే అది తడిచిపోదు అనమాట. ఓకేనా, అండ్ దిస్ హ్యాజ్ ఏ పోర్ సైజ్ ఆఫ్ 800 microns. Nowadays it is coming in different up to 300 also. So it will be a black colored sponge like material. Have you seen that anytime? I'll show you. It will be there. So it will be like for sponge. No regular sponge like that. It will be black colored. So nowadays white color is also coming, but it is made up of what? It is PU foam. So for your understanding, if you have not seen this medically, non-medical uses are, your mattress is there. No, in that also they use PU foam. And there is a scrubber at home, no, in the kitchen your mom will be using or your maid will be using. So that scrubber has one green and one yellow. Have you seen that anytime? So that yellow part is also PU foam. That is hydrophobic. తడిసిపోదు ఎంత చేసినా కానీ. ఓకేనా, సో దిస్ విల్ బి దేర్. సో వాట్ వీ డూ ఈస్, this is a limb, you have an wound here, so we apply the foam here, and then we will seal it with it is tape, nothing but tape, very thin tape. uh, like a plaster, okay, transparent, okay, or we can use IO drape, okay. In CTVS all they use IO drape, in SG they use IO drape. So main concept is that has to be sealed. Then there will be a connector, okay, like a drain we connect, no. So, and this will go to a canister, okay, and this will be connected to a machine with a display, okay, and there will be buttons, and then this will go to the plug, electricity, okay na. So when you have done this circuit completely, then you switch off, it will start sucking, okay, and whatever collection is there, it will be coming here. How this will run? This will create the vacuum, okay na. This is the setup, okay. And initially these were very large and very bulky, but now very small things are also coming, and this is a little bit costly also. Minimum cost is 1 lakh, okay. And these consumables are there, no. This will come in small, medium and large size, and the cost will range from 6,000 to 12,000, okay, per sitting. So that is why it is little bit not popular in government setup, okay. But we can do the cost cutting, that I will tell you later. That's all practical things, okay. So here when we are doing that, you have to maintain certain pressure. So that pressure is approximately 125 mm of Hg, okay na. So here in this the pressure monitor will be there, you can, where you can put the settings, and this pressure can be applied in three different mechanisms. One is continuous, another is intermittent, another is sinusoidal, okay. Name itself suggests continuous ante the pressure will increase and it will maintain like that throughout the sitting, whether it is 36 hours or 48 hours. Minimum is we do for 48 hours minimum. We can continue it up to 4 days also, okay na, depending upon the wound size and the collection. This canister generally it is of 500 ml capacity, okay na. So when this fills, we need to stop it and change it. Sometimes nowadays the advanced machines na, they have auto cut off. Once it comes to this range, the machine automatically shuts off, okay na. So that's how we put the continuous. Intermittent pressure means it will go like this, okay, for some time, uh, depending upon the settings that you have kept in the machine. Then it will come down, then it will go up, then it will come down, then it will go up, then it will come down, okay na. This is intermittent pressure. This is more effective than this actually, okay na. Sinusoidal means combination of both. So it will rise, fall, sinusoidal. So these three settings can be kept, and depending upon the wound and your clinical lesion, it can be done. This is more effective. Intermittent is more effective. Okay, na? So once you have applied that, this keeps on sucking all that exudate, that pus, whatever is there. No, if you while doing the dressing, no, the dressing gets soaked, isn't it? So all those things here, soakage will not be there. This will maintain this pressure, so everything will be collected here. So what that will do is it promotes healing faster, okay. So the regular dressings might take 2 weeks or 3 weeks like that. This will give you result within days. Even the first setting for 48 hours will give you a very good result. So maybe if another, sometimes what happens is another setting is also not required. It stimulates the wound for healing, and then it happens on its own. You need not put a second setting also, so you can save money, okay. Sometimes for certain wounds which are still having exudates, still outpouring pus is there, then you can apply that. Okay. So how it promotes healing is there are a lot of things. It decreases the bacterial load. Okay. The bacteria which are growing there, no, they cannot grow. They keep on get sucking. Then it causes a micro hypoxic environment for bacteria, okay. And then it causes modeling modeling of the tissues, granulation tissues. Physically also it produces certain cellular level micro deformation they say. Physically also it helps in growth of the tissue. Okay, na? So all these factors, still there are n number of factors, but all those things promote the growth of the granulation tissue. So bacterial load is decreased and granulation is increased. That is what is our motive, kada, goal. So the healing happens faster. So after discussing this, you need to know when to use it, when not to use it. Okay, there are certain contra indications for that. So indications will not discuss because a non-healing ulcer is the indication. Okay, like that you can enumerate a number of, but you should know the contraindications. That is very important. So there are four main contraindications. First contraindication is osteomyelitis of underlying bones. So this is a wound, no? So there is a bone underneath, no, anywhere there. So you need to take an X-ray of that part of the limb. If the bone is already having osteomyelitis, you better not do this. Okay, because overlying granulation will be there, but underlying pathology will be still there. Okay, na? So it will not serve the purpose. So osteomyelitis of the underlying bones is a contraindication. Second two contraindications are hematological related. Okay, one is if there is bleeding diathesis, that means there is a coagulation defect. What happens if you put the vac? Bleeding will happen. The suction. Okay, so it is nothing but hemorrhage. The patient will end up in a hemorrhagic shock. So you should not use the second hematological is there is poor supply. That means you see in peripheral arterial disease kada, already ischemic limb kada. So poor supply. For wound to heal, there should be supply. So poor supply. Okay. So if you apply vac, what happens? You are trying to make it heal, but supply is not there. It will lead to infarction of the wound, and it will lead to what is that called as gangrene. What gangrene? Dry gangrene. Okay, so that wound will worsen. So these two are the second and third. Fourth one most important is malignancy. Great, good, very good answer. So malignancy, this is a contraindication. So these four are absolute contraindications, and there will be relative contraindications like poor nutrition. If the patient is having poor nutrition, or whatever intervention you do, it is difficult for the wound to heal. And then immunosuppression. Okay, uncontrolled comorbidities. అంతే కదా. If your diabetes is there and you are not able to control it, how will it heal? Okay, if your CKD is there, if his CVA is there, if his HTN is there, so if these are all not controlled, this will not. So these are the relative contraindications. Okay, na? So this is the overall picture of the NPWT. Still lot of points are there, but for our PG bits, you can remember this. What is the foam used? PU foam. What is the pore size? 800 microns is the minimum size. 300 microns is also available. What is the pressure? Minus 125. They are continuous, intermittent, and sinusoidal. Better is intermittent is the best one. And what are the contraindications? So these can be your PG bits. Okay. Thank you. All the best.